Hi guys, and welcome to the CPAP Mama. So I was asked by a viewer to go through my old masks and kind of talk about which ones really I thought were good, which ones worked for me, and if it didn't work for me, to share what may not have worked for me. So as I've shared in my other videos, I initially started out with the nasal pillow. Then I switched over to a nasal mask because I'm a mouth breather. And then I am going to show you guys, I have a plethora of full face masks because I always say a mask is just like a pair of shoes. You have to try different ones on to get that perfect fit. And that's exactly what I've done throughout the years. So I'm gonna start with showing you my very first full face mask. Now take this with a grain of salt. Like I've had these in a bag for a long time, so they've been loved. So this is the ResMed AirFit F10. I really did like this mask. What was nice about it was like one of the first generation masks that didn't have the head bar here, which was really nice. So if I wanted to wear my glasses when I was acclimating to the therapy, I did that. The other nice thing, it was really easy to get on and off because it just had that simple loop. And a lot of times, you know, just simply taking your index finger and pulling it up and over. Of course, this isn't going to be really easy because I don't have it on my face. To get it on and then to get it off. The other nice thing about this mask, now granted this has yellowed over time, and that's what happens with your masks when they get old. It was a very soft silicone, and I do believe this mask is still on the market. So for those of you who are looking for a lightweight, very comfortable mask, again, this is a ResMed AirFit F10. The other nice thing is the quick disconnect. Pinch it in, pull it off. It has your exhalation emergency flap there. Exhalation port is here. And then, you know, getting your cushion off to switch it out was very simple. So again, for me, this was my very first mask and it worked great. And then the new versions came out and I switched to that. So this was my ResMed. Then I had, of course, tried different masks. Another full face mask that I had tried out was the Respironics. This is the Amara gel, and it was very comfortable. Let me show you. It has, it's not as thick as like the older generation Comfort Gel full face masks, but it is a lightweight gel. And a lot of patients like this. If you get a lot of leakage, and if you're at higher pressures, just having a little bit of that weight really helps. The other nice thing about this particular mask is when you have a higher bridge, what the manufacturer did is there's a little button here, and if you were feeling that air leaking in your eye, there was the adjustment here to bring it closer to you. So this was really nice. And as you'll see here, they have the head bar rest too, and it's a cushion, so it's nice and comfortable. The lightweightness of this was really nice. A lot of the full face masks have like a thicker headgear. The downfall of this mask, and the one thing that drove me bonkers, is the clip. Okay, I always had to make sure I was finding it with my thumb and grabbing it and clicking on and then kind of turning it forward. So I really didn't like the fact of that. Was a downfall for me. And then, excuse me, as I've already shared, you know, I like not having that head bar there. So that's the Amara Respironics. The cushion also comes off, I do believe. Yep, pops right off. Okay, so that was nice, but you have to stabilize it. This was kind of tricky. You have to stabilize it and snap it on. Okay, so that's a Respironics Amara. Now, in old school, which you guys are probably going to be like, what is this? This is one of the very first ResMed. We call this a hybrid mask because it has the option with the nasal pillows. It's a full face mask, okay? So it's got the nasal pillows that go up and inside your ears, but it also covers your mouth, okay? So this is called the Mirage Liberty. And I really liked it, but the problem was I couldn't get it to seal around my mouth. It does, I don't know if it's still on the market, but this was a small, and you could just see how narrow this was. And I used to find that like my lip would fall under it. The other thing I really didn't care for is this silicone is very tacky. Again, this is an old mask. I don't even know if you can still find it. But again, it didn't have the head bar there. Getting it on was just snapping it on off. Now, one of the downfalls of this mask is it has a lot of pieces when it comes to the actual cushion. So like the nasal pillow part comes apart, and the reason for is it comes in different sizes. But I just felt like it was a lot of different pieces, and again with the silicone. Again, I don't know if this is even still on the market. It's like an old school. And then the other big issue was getting this seated on properly was always kind of a pain. But if you're a patient and you're struggling with having a lot of issues on the bridge of your nose, a lot of breakdown, and you like having a nasal pillow, this may be, if you can still find one, an option. All right, then I've tried out more recently some of the newer masks, which I believe I've already shared this. So this is the ResMed F30. Okay, what I really love about this, it's got the magnet, okay, and this is neat in the sense that it's a full face mask, okay, your nose sits in here, so it gets cradled under your nose, and then your mouth goes around, so you can see like the difference of comparison here of like how they've come a long way. Same manufacturer. This is much narrower and this is more wider. The silicone on this is also very more comfortable, so much more comfortable. The only thing I didn't like about this is I couldn't get it to not leak, and I have a small nose, and this, believe it or not, is a small, and I still couldn't get it to fit. Bummer, because I was really hoping that this was gonna work for me, but it didn't. Quick disconnect, just like my F20 Air Touch, so I really liked that. All right, so that's a ResMed. Another mask I've tried, which I've shared about, this is the Fisher Paykel New Vitera mask. This is a mask that I rotate between my ResMed F20 Air Touch. Okay, so I use this mask and I use this mask. I rotate. And what I really like about this one is the silicone is very soft. It has that roll technology, so it doesn't put a lot of pressure on the bridge of my nose. Again, the silicone is soft. The downfall of this particular mask, as you can see, is the head bar. But hey, you know what? Not that big of a deal. I also like the mesh in the back because as summer approaches, not to be gross, but like you get hot and sweaty back there. And then just to simply attach, you pull back, push forward. So that's the Vitera. And then last but least, I've also tried the Respironics Dreamwear Full Face Mask. Now the benefit of this one, as you guys can already see, you attach your tube on the top, okay? This also has a magnetic, okay? The air fills through here, so if you are a side sleeper, you have the air going around. Same kind of concept is the ResMed F30. Your nose sits right in here, cradles, and then your mouth. Same issue I had with the F30, I had with the Dreamwear. I just couldn't get it to seal right here. So if you don't have a small nose, this may be a really good idea for you. This may work. So you guys, that is my plethora of masks that I had. I'm sure I've had more. I know I have, but I haven't kept them, and I'm honestly surprised I've even kept these. I always like to keep a backup just in the event something breaks, but I honestly didn't think I had that much, and I'm glad I did because I got to share it with you guys. So please like and subscribe, and if you have a topic that you would like me to talk about, please message me. All right, you guys, have a fabulous one. Bye-bye.